Osteopathy for your baby. What is this all about? I first encourage you to go to the video on this website that's called What is Osteopathy? That will help. And then this video will also help as well. So why would you bring your precious little newborn to come for some osteopathy treatment? The main reason is for problems with feeding. That is sort of the main thing that I have been treating when treating little newborns. And it's either maybe the mouth isn't fully opening wide enough, or it's really, really painful for the mom, or maybe there's a lot of screaming and really you can tell your baby's like not enjoying the breast feeding time. And those are some of the reasons why we would treat it. And a lot of times you're referred to osteopathy by your lactation consultant, who can tell that there's something sort of not working exactly properly, and treating the baby will really help. Another reason is tongue ties. And this goes, of course, with having trouble breastfeeding. We do get a ton of referrals from Dr. Newman's clinic where they treat tongue ties. And I'm gonna have a whole other video on that for the tongue-tied people, because there's so much great information I wanna share with you. And so just know that tongue ties are a reason to bring your baby for osteopathy, or as well as if you've had the tongue tie treated, you would come as a post follow-up solution for having the tongue tie treated. Another thing is if the baby's always looking one way, and maybe that means they prefer one breast more than the other, likely due to comfort. So again, there's torticollis, which is your baby sort of stuck in this position, but there's also just always rotating to the right. They sleep like this. When they're on their back during the day, they're like this. So that's another reason why babies come for osteopathy treatment. And another is digestion. So there can be some reflux. There can be just a lot of spitting up. So you're kind of worried, is my child getting enough food even? And then there's constipation. And then if there's a lot of gas, you may want to, your child may benefit from having an osteopathy treatment. And as well, if they're not necessarily constipated, but they're really straining when they're doing a bowel movement and seem uncomfortable, or maybe they're screaming. So there's some, babies usually are showing us where their discomforts are, and that's something that we can help your baby with. If there's a lot of asymmetry at the cranium, usually this comes with these types of symptoms, but maybe a giant cone head, who treated that, or plagiocephaly, where the shape of the head isn't normal. We can help with that, and as well as if there's asymmetries in the body, perhaps a club foot. I've never treated a baby with a club foot, but I have treated, a 10-year-old, and I really wish I had got to treat her. The sooner the better, right? So those type of asymmetries in the body, maybe there's a little scoliosis. You may see that later on when your baby is you can see them. I just treated someone who, they had hip dysplasia. So they were in that harness for about 3 months just to keep the hips, to heal that problem. But then at 8 months old, they had a scoliotic curve starting, and we were able to fix that pretty quickly. Because it was because of what had gone on with the baby being strapped down in the harness for the first 3 months. Okay, so that's another thing osteopathy is very, very helpful for. And as well, if there's a lot of congestion, or you find that they maybe, when they're a little bit older, you notice they're getting a lot of ear infections, we're really good at helping with that, because it literally can be just a little angle, changing the angle of the tube so there's better drainage. And we can help with that. And as well, you want to notice if your baby's snoring at night. If they're a foghorn, if they're super loud, that's something that we would actually like to treat. It's normal to have a baby who's a very quiet sleeper. Okay, and as well, if they're just maybe they have older siblings and they're always getting sick and have a flu or that type of thing, we can help sort of boost their immune function. And as well, some people like to come for us right after they get their child vaccinated, just to help with getting rid of, some of the toxic stuff that goes along with that process. we're very good at that. So those, I think I've covered it all of the main reasons why you would want your child to have osteopathy. And the main modality we use, as we explained in the other video, when we do osteopathy, is CranioSacral Treatment. So this is your cranium and this is your sacrum, where your bum is. And we can treat those areas and really help what's going on for your baby. So for example, the facts are our bones, like this one bone here, it's in 4 pieces in a newborn, okay? So there's a lot of mobility of all the bones of the head. This is a good thing. It's coming through a very small hole. This is how we're all designed. But what can happen, as we know, the deliveries can be both traumatic for the baby and the mom. So what we want to educate you about is that the bones can shift, which is good, but we just want to make sure they're shifting into the correct position. So for instance, I'll just give this example again. If these are shifted, there's lots of important nerves that come out of this bone. So if you're shifting the bones, you may be shifting the pressure on the nerves. For instance, the vagus nerve comes down and innervates all our organs. So maybe that's tied into constipation. So there's all these different ways that we can help your baby. If any of these symptoms are you or your baby, then please come for some osteopathy and see if it can help you. Thank you very much. Bye-bye.